Hi, everybody. Welcome back to another eye health conversation with Dr. Okogbaa. Thank you so much for being here today. So, recently I was seeing a patient who had diabetes, and upon her examination, I found that she was having diabetic damage in her retina. Okay, and the question she had for me was, "Doc, can I lose my vision from diabetes? Can I go blind from my diabetes?" So, today on our conversation, we're going to explore that. Is it possible to go blind from diabetes? Well, as you know, diabetes is one of the leading causes of blindness in the United States in patients over 40 years old. And so I really wanted this is such an important conversation to have because we have millions and millions of people who have diabetes, and a lot of times they're not aware that their eyesight is at risk from going blind uh, from this condition. And so in the U.S., 9.6 million people have something they call diabetic retinopathy, which is when the blood vessels in the eye starts to get damaged. Sometimes it happens slowly. You start getting new blood vessels. You can start getting swelling back of the eyes. And so there's a whole range of degrees of diabetic retinopathy that happens in the retina, which is the sensitive tissue in the back of your eyes. And so millions of people have this condition, and they said that at least 1.8 million have what they call vision threatening. So that means millions of people also not only they have damage, but that damage actually put them at risk for developing going blind completely. And so again, this is such an important topic to really discuss. And so my answer to that question is yes, especially if your blood sugars or if your diabetes are not controlled. Your risk is 25 times higher to develop diabetic retinopathy or and lose sight, lose your vision from this condition. And so I really need you to pay attention. I'm going to give you 3 to 4 tips. Actually, no, I'm going to give you four. Let's give you 4 tips to help maintain your eyesight, to help you keep from losing your vision from diabetes, or what we call diabetic retinopathy, which is how the eyes, when the blood vessels are filled with glucose, or your sugar is so high over time, it just constantly changes the blood vessels, weakens them, and damages them. And that will result into problems for your eyes, okay, including loss of complete vision. So my first tip, think about ABCE, okay? So A stands for your hemoglobin A1C. Think about A1C. This is a very important number you need to know because it helps you to know how well your glucose and your diabetes is being controlled. And so when a patient come to see me and they are diabetic, I want to know, what is your A1C? What am I working with? Is it 10? Is it 6? So, and already, not only do I know that number will tell me, what's going on with the eyes just from that, knowing that number and how long it's been like that. Okay. And so, what we want is your A1C to be as close to 6 as possible. Okay, the lower for that number, the better for your eyes, the better for you generally, your entire body from complications, from getting complications from diabetes. Okay, so hemoglobin A1C, that's a number you want to know. So whenever you get blood work, they will check that, and that's a number you always want to know and have with you. Okay, number two is control your blood pressure. Blood pressure, B for blood pressure. So when your glucose is high, your blood glucose is high, and your blood pressure is high, that is a double whammy on your blood vessels, especially your eyes, who has millions of tiny capillaries, small blood vessels. The eyes get a tremendous amount of blood given to it because it needs a lot of blood to function. And so imagine if all of these blood vessels are under high pressure and have high glucose. That's a combination for making things really worse. So you really want to keep your blood sugar and your blood pressure under control. So that's tip number 2. Tip number 3 is manage your cholesterol. Cholesterol can clog up those blood vessels and adds more problems to you. Okay, and so you want to manage that as well. And I'm going to throw in C for cigarettes too, or any kind of smoking. Smoking worsens everything. So with the eyes, diabetic retinopathy, it makes it worse, and it causes your eyes to be in a more vision threatening state with smoking. All right. So those are 3 tips. And number four for E is get your eye check up. Even when the vision is great, do not skip your annual eye examination. And so for E, I like to say the minute your primary care doctor diagnose you with your diabetes, the next appointment is with me, the eye specialist, so I can make sure that you have not already developed damage from the diabetes from the get-go. Okay, so very important, do not skip your eye checkup because it can be subtle. The damage can be subtle, and we want to catch things early. We want to catch any changes early so that we can help your eyes. We can help the vision. We want to help you maintain your eyesight. And so those are the 4 tips. So number 1, you want to manage your A1C. We want that number as low as we can get it, closer to 6 as much as possible. And need to know that number. When you come see me, the eye doctor, you need to know your A1C number. Very important. Number 2, you want to control your blood pressure. Blood pressure, you do not want that elevated because it just adds more to the problems that the sugars are already causing. Number 3, we said cholesterol. We got to manage our cholesterol. We want to quit smoking. If that's an issue for you, you want to really quit smoking so that it doesn't worsen problems. It doesn't worsen diabetic retinopathy, and we don't want it to quicken or accelerate your vision losing sight or you going blind. Okay. And lastly, do not skip your eye examination. If you have not gotten an eye exam in this year, 2024, make sure you call as soon as you finish this video. Call and make an eye appointment with your eye care physician, or call us if you're in the Baton Rouge, Louisiana area. We'd be more than happy to partner with you to help you maintain your eyesight. That is all I have for you today. Remember these tips to help you keep your vision. And so if you found this helpful, please, or if you know anyone else who could use this information, please share this video. It would mean so much. You can be saving somebody's vision. You can keep them from losing their sight by just sharing this information. And so thank you so much. We'd love to see you, and enjoy the